From flourishing culture, joy, and diversity to the struggle for equity and justice, Africa is a continent of contrast. In this episode of Charter4Health, we explore the challenges to health defenders and the struggle for the right to health in the global south from an African perspective. Welcome to Charter4Health, a PHM podcast series on the right to health. Here are the voices and insights of health rights defenders at the forefront of the struggle for health for all from around the world. I am your host, Miguel Garcia, and this is Charter4Health, a new podcast series from PHM Global. Follow and share from wherever you are on iVoox or go to our website, phmovement.org. We are the People's Health Movement. Join us in the struggle for health for all. Our guest today is Denis Joseph Bukenya, human rights and health rights activist. Denis is the coordinator of the Human Rights Research Documentation Center in Kampala. He's also the regional coordinator of the People's Health Movement, Uganda. Hello, Denis. Welcome to the program. Thank you for being here with us.
Thank you, Miguel. Thank you for having me there in this program.
How was your experience participating in the 5th People's Health Assembly in Argentina?
So, for starters, I want to say PHM never disappoints. I mean, every time you have your expectations, you get a full plate. My expectations with the People's Health Movement here at the PHA5, I think, one, the diversity in ideas was big for me. Listening to people talking from global health to community perspectives. How do we cause participation from the grassroots to this level and then to the global tables? Really, those are some issues that came out for me visibly. And then, of course, talking about the multinational corporations and the power they have, and the fact that, if you know the movement, we don't really have money to fight against the multinational corporations, but we have the artillery of words, and we have the information of the evidence we can use against the multinational corporations, and how best we can use that as activists. For me, really, that didn't disappoint. And then, of course, meeting a few young activists who are pro multinational corporations and all that, and then we have to talk to them about that kind of advocacy and what it is impacting their communities. And then, of course, hearing from those who have done it firsthand, then the history of the movement. I really am in the right place, and I think I have a full plate of my expectations being met at this PHA5.
Let's talk about the struggle for health in Africa and in your country, Uganda. What's the situation there?
So the People's Health Movement, I would start with, is more of a community movement. It's nothing at the national. It is more of the communities and at the grassroots. That is where our engagements happen most. And the way the People's Health Movement Uganda works is that we work through our partners because of the issue of funding. Now, for the issue of Africa and its struggles for health, that's where it begins, with the people that we work for in the communities, or the people we help, we advocate for better health or the struggle for health in the communities, being challenged with having no information for beginning or for starters. They don't know what to do. So you find that the policies that come from above, say come from the governments, impact them. And they don't even know that the governments are supposed to provide for them. So they think when the government, for instance, gives them free medication, it is a privilege, which is not. It is a right. So the struggle has been with the government calling us political saboteurs and labeling us, because you are telling the truth. And when you tell the truth, you revolt the communities. So it has been a bit of a challenge for me as a coordinator of the People's Health Movement, one, in Uganda, because I have to protect my people so that they don't end up or the wrong side of the law, and also so that they don't end up being incarcerated or even losing their lives. So that, for me, is critical, because then you find that being a movement has been the protection, because with the People's Health Movement, it's not necessarily a national organization that they can clamp down on us. And then, of course, we work with evidence, which we share upwards. So from the grassroots, we share this information upwards with the people who matter, and they use it in the right places. So that has been one of the biggest struggles. How do we necessarily create the evidence that is impactful and very strategic in such a way that, one, the activist who is carrying the information is not incarcerated or is not harmed by the government that causes them a saboteur. Two, that it goes to the right places to be used for the right reasons. Yeah. And then when now it comes to the region, because we work as the Eastern Southern region, that's where I have mostly worked. We have these regular meetings where we discuss strategies. And in these strategies is where the campaigns come from. So we have several times encouraged campaigns. And for me, that should be one of the richest approach we have as the movement. However, sometimes we have met snags in that the campaign is seen today and then we don't see much vibrancy within the campaign to kind of come back and impact the communities or have the people in different countries remain behind those campaigns. I will give you an example of the AHA law in Uganda, the anti-homosexuality law in Uganda. We did a lot of work and tried to connect with our brothers and sisters to see how we can create campaigns that were grand, that would kind of create voice outside Uganda so that the criticism that is coming from outside Uganda could impact governance issues. And we have the law looked at with a more keen or eagle's eye. But really, I think I didn't hear much noise coming from outside, and it was us, the activists within, who remained branded. And actually, we have some of our people who lost their premises where they were working. And you know how difficult as an NGO it is to get a home where you work. So some people are being evicted. We have individuals who are now in hiding because they have been labeled as Western puppets. That is infiltrating culture. And now they have turned our people in the communities who are most important in these kind of advocacy struggles we do against the activists. Now, what happens is that we need the people or communities when we do our health rights activism. So if you turn the people against us, labeling us puppets from the West, I think that is very dangerous for all of us. And it now calls for us to sit again in the struggle as we do this struggle for health. It calls for us to sit again and reevaluate our approaches, rethink the strategy, because the time our strategy has been informing the communities of how the government is supposed to be the provider for the right to health, not a privilege for it to provide, and then we are associating with them to become or demand for themselves. But now you have a situation where you have been branded as a saboteur or Western influenced puppet who is influencing politics the wrong way, and so the people now are not trusting you anymore. So the strategy has to change, and we see how we work towards better health, right for health.
Let me take a step back to talk a little bit more about this so-called anti-gay law in Uganda. A few days before the assembly, Uganda's Constitutional Court refused to dismiss an anti-LGBTQ law considered to be among the world's harshest in sexual rights and has drawn condemnation from human rights defenders and sanctions from Western nations. A law that includes the death penalty and which violates fundamental human rights. What's your take on the decision by the Constitutional Court in your country?
Yeah, that was quite a telling. And the law in itself, if you tried to peruse the sections, I think they were quite absurd. And it was a sad day for all of us activists and human rights lovers, really, or human rights activists. Really, what my take is generally the fact that this was absurd for us. However, I want to go into detail of considering why I feel sad about whatever happened. One, when you look at the judgment of this Constitutional Court decision, it was basically a judgment that was hinged on the cultural norms of the country. And to that extent, it begs the question of what are these norms anyway, Because actually when you look at our constitution in Uganda, it talks about repugnancy of these norms to the extent of their applicability. And that is a question that we probably need to interrogate. And I think that's a beautiful angle for us on appeal. Now, that notwithstanding, it has immense impact on people who associate as LGBTIQ people. But not only that, also the people who end up associating with these people as they transact their businesses and day of life. In effect, what the law is asking people who are engaging with anybody who associates with LGBTIQ people is that it wants you to isolate them. The law is telling us to neglect them and probably send them out of our societies, which actually is a derogation of their rights as individuals. What happens is that, one, we are going to have a high prevalence of HIV and AIDS disease. It is going to increase. Actually, it is increasing already. We can see that. We are also going to have their treatment-seeking behavior downtrending, and that is also dangerous because we are asking everybody, if we want healthcare for all, to have a character or a behavior of health seeking. That will go down. Yeah. Also, these people are going to be isolated and they will be in hiding, and their rights will be derogated. But also, there is a high likelihood of the fact that they are going to be witch hunted by the communities because of issues of poor propagandism. Yeah. And then also, we are going to have issues of donor aid coming down because we, as a nation, we shall be punished for this law. And the punishment for this law is going to call for us to forfeit some of the aid that we so very much need in terms of the health system. And that has two sides to it. The question is, how do we have this law not affect the health of others so that those who are continuing to get aid continue, so that we continue getting the aid, the much needed aid in our health system, but also the perpetrators in government get punished for what they are doing because they're hiding within the people who are really not the unsuspecting public. But also now let's further interrogate the law in itself, what we can actually do to help our citizens or our people who are law-abiding citizens and seeking treatment. I think what we need to do as activists is to start to interrogate some of the sections within the law. For instance, the section that talks about the landlord who rents out his premises to that person who associates or does business in LGBTI business should also be incarcerated for aiding. I think we need to start with that and have some of those low-hanging fruits first of all dealt with and probably have these sections quashed. Then we need to also talk to as many donors as possible and still remain positive that, you need to still help us with aid because our health systems are dilapidated without aid. But most importantly, start to create voicing or voice our dissent on the law itself so that we can be heard and document our efforts towards the rights of people on LGBTI. But most importantly, we need to continue the advocacy approach through public interest litigation.
We're going to take a short break. We're talking with Denis Joseph Bukenya from PHM Uganda. After the break, we'll take a bite at the health struggles in Africa. Stay with us.
We
are the People's Health Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website, phmovement.org, and find out how.
Contribute
and say
proudly
that you support
health
for all.
Health for all.
Health for all.
Health for all.
Health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
The World Bank issued a ranking and austerity measures plan by country for 2023 and 2024. What is the impact in the economy and access to health in a country like Uganda?
Before I answer your question on the impact of the World Bank hostilities on the economy, I'll want to just keep it around the taxes, and then slowly I'll dive into its impact on the healthcare system. Now, when you talk about the hostilities by the World Bank, the impact now will rely on heavy or high taxes for the people within these communities or within the global south. And for the global south, I'll focus on Uganda. So for Uganda's case, you'll find that a person who is earning almost $470 will pay back almost 30% of that in taxes, and that does not in fact reflect the VAT or value added tax. So that means in effect we are not going to have any nationals or people who are actually paying taxes developing in Uganda. And when there is no development, that means there is no growth. And in fact we would say probably we are going to have investors, but these are hostile taxation regimes that no person in their sane mind will bring their competitive company like, say, Nike to invest in Uganda and create employment, because there is a hostile tax regime. So there is no development. I'll leave it at that. So that will be the actual impact for me that I see, and so many things can underlie that. Then I want to go to the issue of the healthcare systems. Now, since the taxes are not being collected for the people, the collection now of these taxes is basically to show the people who are loaning us, giving us these guarantees and all, that we can actually pay back as Uganda. But because there is no development, that means we shall need somebody else now to donate to us means of survival or servicing our budgets in terms of the national budgets. But what that means is that there will not be growth out of this borrowing. There will not be growth out of this receiving of aid and other handouts of certain structures. So if that money is all sent to repayment of tax and debt, then that means there is not enough money to create infrastructure for the healthcare. And that is now where we turn to another angle, where the World Bank created a structural adjustment angle, where they were talking about issues of public-private partnerships, that these ones will fill the void and help us to achieve the universal health coverage funding gap. But now the challenge with this comes down to issues of numbers, or comes down to issues of reality. So are we sure that if public-private partnerships come, they are going to create access to care and infrastructure development? I think not. The private-public partnerships are going to be focused on profit and for profit only. And the two will never meet. There will not be healthcare for all. So the impact basically here is that there will be extensive unaffordability, and we shall have an issue coming into play of playing the healing mission. What do I mean by healing mission? Where the rich are protected from disease, and quote me right, the rich will be protected from disease while creating treatment of disease for the poor. So there is nowhere the poor are considered. Maybe I need to talk about the solution to all this. The solution to all this for me would be, playing the democratic part at the helm of the World Health Organization. That whatever they discuss should not be locked doors with the people who are only trending from the global north, but include the people's voices from the global south. Countries like Uganda should bring you their voices, and they should hear what you're discussing for them so that you can be guided. On that note, I want to submit.
I want to take you back to the PHA5. Let's talk about the connections and the collaborative networks beyond borders that can be generated in an encounter like the PHA5, where people from different places and different cultures can meet and work together. Let's talk about this.
That is a very important issue. And for me, it should be the red line or it should be the highlight for the People's Health Movement in a PHA. So the PHA5 has been, one, a place to share best practices. As you may agree that many people have many strategies towards the same issues. Now, coming together creates one understanding of how you can use someone's strength in strategy to your advantage back home in the advocacy you're doing. However, it is also should be a place where we sit to create common strategies. We strategize and unify our strategies towards dealing with issues. And that's the place where people with information come and show us how best that information can be used. That is where we share materials from our own advocacy. If you have copies of your reports and things you've been doing that you think can help activists, I think this is the place. But also, I think it's another issue that we need to think about to increase the numbers of participants in this. I know it's an issue of resources, but still, we need more activists, coming from the country, probably carrying individuals as case studies of what they have been working on, say victims of political incarceration or something like that, so that we now hear more from their perspective, how they are dealing with the trauma, or we actually are able to work with them to come out of the trauma or in many cases also get to meet with people who are helping them outside their countries where they live. So connecting it back to the PHF5, I think we have tried to do that, but the numbers of people coming from different countries has been limited. And also the time we have had to do this is also limited, so you find that programs are a bit quashed in. And probably we should also share information before we come so that people know who is coming, so that you target them directly to be able to vastly benefit from their knowledge and experience before you're here. That will be my take, briefly.
Thank you, Denis, for being here with us.
Thank you very much, Miguel, for having me. It has been a wonderful experience sharing with you.
We are the People's Health Movement, bringing together health rights activists from around the world. Join us in the struggle for health for all. This episode of Charter for Health was produced by Annelien de Coquelar, Anna Brachar, and David Berstock. Editing by Luisa Fernanda Viatella. Technical support by James Von Duren, Edwin Otzin, Gabriela Tumash, and Esmeralda Ramos. My name is Miguel Garcia. This is Charter for Health, a PHM podcast. You can find much more about PHM and its call to action by logging into our website, phmovement.org. This is a People's Health Movement production.
Hey everyone, I'm Chiara Bodini, co-editor of the Global Health Watch 6, flagship publication of the People's Health Movement. I am also a producer of the GHW podcast. Listen to the first season of our podcast in English, Spanish, French, and Arabic on iVox. You can also go to our website phmovement.org/GHW-podcast.
It's a little poem titled The People United. We are the seeds of the trees whose trunks resist the bloodied machetes of the bosses. We are the waters of the seas, brimming with life, being one in our diversity. We are the song of silence, shattering the noise of their market. We are the land on which they walk. We are the air they breathe. We are the ones they dismiss. We are one with the earth they bleed for wealth. We are yesterday. We are today. We are tomorrow. We are the people. We will not be defeated. El pueblo unidos. Jamás será vencido. El pueblo unidos. Jamás será vencido. Thank you.